treated as the ASAs. Both the sides it should be the equal height. And at the posterior side also, both the sides it should be equal at height. How we will assess? We will be sitting in a plane and we will be asking the patient rotate like this. You should be rotate like this. Can you do like that? We have to get up and move. Most probably, if the patient is not affected that much, okay, fine. We will be at the ground and we'll be at half kneeling position so that we can ask the patient to turn around. That's not a problem. Suppose if they are affected, we have to move around. We cannot always ask the patient to rotate here, rotate here. We cannot always ask the patient like that. Anteriorly, we can assess the ACS, both the sides. Posteriorly, we can assess PSAS, both the sides. And as well as, I told you, see, here, ASAS, both the sides. Here, both the sides, PSAS. It should be at the same horizontal plane, right? And in the side base, you have to see the ASAS plus PSAS. For example, ASAS is here, PSAS is here, okay? After the bend I am saying, ASAS, PSAS. Can you say whether both the fingers are at equal height? There it is. Equal height. Whether both the fingers are at equal height? Which one is high? This one is high. How far? Half inch or 1 inch? How far? Half inch. So half inch is okay, acceptable. Half inch to 1 inch, maximum 1 inch. Okay, fine, acceptable. Okay. But beyond that 1 inch or 1.5 inch, it is not right. It is not acceptable. Right? That means something abnormal. So it indicates that ASCS, for example, ASCS is here. PSAS is here. My right hand finger, this is dropped like this. Okay, further, more than 1 inch or something, 1.5 inch or something. Okay, it is dropped like this. It indicates the ASAS is lying down. That means the anterior abdominal wall, the lower anterior abdominal wall is not able to hold it. Okay, now you tell me. Anteriorly, what are the muscles should act to make it the pelvis? Abdominal muscles. Posteriorly, what are the muscles should act? The lumbar region, all these muscles, spinal erectors, all these muscles, right? It should work like this. Laterally also, here all these muscles should work. Roughly speaking, at least abdominal muscle, then back muscles. These should work. Imagine the abdominal muscle is weak, especially the lower abdominal muscle is weak. Then the maintenance of the ASIS is not properly held. So it will drop, right? It should be like this. But the abdomen is weak. So it will be like this, right? So this is what will happen. So when this is happening, what will happen to the posterior region? As we know, agonist and antagonist should cooperate with each other, right? When the anterior region, the agonist is not working properly, so what will happen to the posterior muscle? It will go for compensation, right? Ultimately, it will go for tightening or what? Right? It will go for tightening, right? So tightness of the lumbar region muscle, back muscles, right? So abdominal muscle will go for weakness and lengthening. Then the lumbar region muscles that will go for tightening and shortening. So that means whether the strength of the lumbar muscles is not affected, no. Point is both abdominal muscles as well as the spinal erector muscles, both the muscles are affected, both are weak only. Here it is going for elongation, here the compensatory shortening of the muscle. So the patient will be always complaining pain over this region. And slowly it will spread to the entire lumbar region. Right? Okay, this is initial. This is initial because the posture is affected like this. The especially the lower lumbar region, just below the belly button, it will be affected. It will be affected. So the proper holding of the pelvis is not there. So here it is short, it is lengthened, and here it is shortened. Right? slowly it will be compensated and spread towards the entire lumbar region. This is the initial. And what will happen? In due course, the patient will start to compensate like this. The first compensation of abdominal weakness is this. Patient always try to hold like this. Hold their hands like this. And slowly, in due course, second option, they'll hold like this. So to compensate the muscle weakness, they'll hold like this. And in due course, this is initial, that is second stage. And in later stage, always hold like this. Along with this, they'll try to keep their pelvis like this. They'll sway back and keep their thoracic like this, toe like this. Can you see? The pelvis is little most probably in the anterior region, right? It is shifted more anteriorly and is compromising by means of thoracic leg.